Hello, everyone. Welcome, welcome, welcome. As I look around, I'm proud to see attendees that we know, ranging from all the way from Illinois, Texas, California, South Dakota, and I even see a few from India. Well, welcome to the 2025 Unity in Public Health Research Conference, Innovation in the Age of Misinformation. My name is Pranav Mehta, and I'm one of your co-founders and executive directors at Project Unity. Thank you for taking the time out of your day to join us and learn more about Project Unity. After this conference, we hope that you leave more educated about public health, discover a new interest, and are inspired to take action. This conference would not have been possible without the incredible support of our Unity ecosystem partners, the institutions and organizations that believe in empowering youth as agents of change in healthcare. Your belief in our mission has turned today's gathering into a reality. We're especially grateful to the Common Health Coalition for being a driving force behind Project Unity's national efforts. The Common Health Coalition has played a strategic role in equipping youth with the resources, mentorship, and guidance needed to bring this entire vision to life, the 2025 Unity in Public Health Research Conference. We deeply value your partnership and look forward to expanding our impact with you and with new collaborators here in the audience today in the future.
Hello, I'm Morris Shaw, a co-founder and executive director of Project Unity. It's a pleasure to see attendees from all professional backgrounds and academic programs from around the country here with us today. For our agenda, we'll start off with an overview of Project Unity and the Catalyst Academy Summer Program. Next, we'll kick off with the highly anticipated Unity in Public Health Research Conference for the Western, Central, and Eastern regions of the United States. Following this, we're going to hear from our honorary keynote speaker, Dr. Geeta Nayyar, a cutting-edge healthcare leader in digital health innovation. And afterward, we will then announce the finalists for the Innovation in Public Health National Research Conference and conclude with our Public Health Awards ceremony, where we recognize the top students around the United States for their research, posters, and public health leadership. Our Catalyst Academy leadership team brings together a powerful blend of lived experience, creative vision, and deep commitment to education and health equity. Together, we span backgrounds in medicine, public health, digital health, and education, and we've built Catalyst Academy not just as a program, but as a movement. We come from different parts of the country and different institutions, but we honestly share one mission: to empower the next generation of healthcare leaders with the tools, mentorship, and mindset to create change. This team that you see in front of you today has been behind the scenes every step of the way, and we're so proud to be with you here today. We are guided by our nationally recognized advisory board, composed of leaders who serve in influential roles across healthcare, public health, and innovation. From health system executives to medical school faculty and national policy advisors, each member brings unique expertise and a shared commitment to our mission. This board has helped shape our vision, strengthen our programs, and ensure Project Unity is not only bold, but built to last.
So, what's the context? Right now, we're living in a time where information is more accessible than ever, but at the same time, trust in that information is also rapidly breaking down. And the statistic is alarming. At least 4 in 10 people have said that they've heard at least 10 specific false claims, not just about COVID-19, but also reproductive health and gun violence. And these aren't fringe beliefs. They're mainstream narratives that are shaping health outcomes, public trust, and even policy. And so misinformation isn't a side issue. It's the defining challenge of our generation. And if we want to prepare the next generation of healthcare leaders, we can't afford to ignore it. We must equip students to navigate it, question it, and respond with empathy, courage, and integrity. Youth throughout the country have a hunger to lead. We all know that. They want to serve, to make a difference. But far too many feel unequipped to do so. Only 20% of young people believe they have the skills, support, or capability to solve problems in their own community. Not because they don't care, not because they lack potential, but because we haven't built systems that trust them, train them, or take them seriously. And that's the opportunity we see in front of us.
The future of healthcare depends on our leaders being equipped, not just with clinical knowledge, but with a deep understanding of the systems, technologies, and social forces that shape health. These are the foundations for future healthcare leaders. And our students don't just learn these concepts, they apply them every day. We're facing a paradox right now. On one side, we have a generation that's ready, young people inspired to make a difference in health. On the other side, we have a disconnected system, countless health education opportunities difficult to navigate for students. These two powerful forces are feeding into a system that's already fragmented, divided by specialty, sector, and silo. What we need now isn't just more healthcare providers. From the gaps exposed during the COVID-19 pandemic to the uncertainties of the ongoing digital health transformation, we need multidisciplinary leaders, those who deeply understand how public health, medicine, and digital innovation can work together to advance health equity. People who can connect the dots and rebuild trust across our communities and our health systems across the country.
So our answer to that fragmented system we see in a generation searching for direction, that's Project Unity. We're a 501(c)(3) nonprofit dedicated to building the next generation of healthcare leaders at the intersection of medicine, public health, and digital health. We believe young leaders can drive innovation, rebuild trust, and create more equitable systems. And that's why our mission is clear, to train leaders who are collaborative, interdisciplinary, and ready to meet the moment. At Project Unity, our work is grounded in four core principles, the foundation for everything we do. If this is your first time joining us today, everything we do is youth driven. Young people aren't just participants in our program. As you see today, they lead them. From designing new initiatives to driving local change, students are at the center. We're community rooted. We don't parachute in solutions. We co-create with the community, not for the community, with the communities that we serve, ensuring that our work is grounded in trust, voice, and long-term impact. Evidence-based. We rely on data, not assumptions. Through constant feedback, testing, and iteration, we improve each of our programs to maximize real measurable outcomes. And finally, we're focused on being interdisciplinary focused. Today's challenges don't live in silos, and that's why we integrate public health, medicine, and digital innovation in each of our initiatives to help young leaders think holistically and act boldly.
Our Unity Innovation Lab houses our three flagship programs, each designed to equip the next generation of healthcare leaders in a unique way. First, Catalyst Academy, which you'll hear more about today, is our intensive summer program that provides students with early training in public health, digital health, and medical innovation. Secondly, we have the Youth Public Health Innovation Coalition, our national accelerator for youth-led initiatives across the country. Think of it like Y Combinator for community health. We provide funding, mentorship, and infrastructure to help student projects and nonprofits scale their impact. And finally, AI Med Trailblazers, our newest AI education platform, teaching future healthcare providers from all sectors how to navigate the digital health AI shift with confidence and purpose. Now, off to Justin to talk about the program that started it all.
Hi, everyone. My name is Justin, and I am the Senior Director of Education for the best summer program ever, Catalyst Academy, in my non-biased opinion, of course. This is the problem at the heart of our work. Today's aspiring healthcare leaders are passionate and driven, but too often they're unprepared to tackle the most urgent, complex challenges of our time. At its heart, Catalyst Academy is about more than just knowledge. It's about building capacity. We start by helping students strengthen their foundational health literacy so they can understand and navigate the complexities of modern health systems. Next, we focus on sharpening critical thinking skills in research, problem solving, and innovation design, because real world impact doesn't come from memorization, it comes from creativity, analysis, and execution. And finally, we're building a new generation of multidisciplinary leaders, students who are mentored, challenged, and supported through project-based learning to apply what they've learned to innovatively generate impact. So how do we bring this vision to life? This is the Catalyst Academy roadmap. a curated experience designed to develop future healthcare leaders from every angle. Students learn from globally recognized educators across medicine, public health, and digital health. They engage in community-centered leadership, working alongside stakeholders to understand real-world challenges. We offer professional development workshops that sharpen communication, confidence, and leadership presence. Through personalized mentorship, students explore their own career paths and gain insight from professionals across the healthcare spectrum. They also engage in project-based learning, where their ideas become action through healthcare innovation initiatives. And finally, they publish in our research journal and present at today's National Scientific Poster Showcase, building real skills in communication, research, and advocacy. One of the most powerful parts of Catalyst Academy is the access students get to leaders across healthcare, public health, tech, and policy. This summer, we were incredibly honored to welcome guest speakers and mentors from institutions like Harvard Medical School, the Food and Drug Administration, the Centers for Disease Control and Prevention, Duke, Yale Law, Microsoft, and many more. These experts brought real-world insights into medicine, digital health, public policy, misinformation, AI, and systems leadership. But what stood out the most was their willingness to meet students where they are, not just as future professionals, but as leaders right now. It's this level of access and conversation that turns curiosity into confidence. This program was an 8-week program, and I know that 8 weeks sounds short, but I am sure if you ask the students, they had takeaways that they will carry for the rest of their lives. This success would not have been possible without our fantastic undergraduate and graduate mentors from medical and public health backgrounds across the United States, including institutions like the University of Southern California, University of California, Los Angeles, George Washington University, University of Maryland, Yale, St. Louis University, and Columbia. Thank you to each of you for your investment in Project Unity and for helping build the next generation of interdisciplinary healthcare leaders. This summer, after a competitive application process, we had the absolute honor of welcoming 3 cohorts of 52 ambitious high school students hailing from 13 states and spanning the western, central, and eastern regions of the United States, a powerful testament to the nationwide reach and rising momentum of our mission. Cohort 1 here, as you see, represents the Western Conference. Cohort 2 here represents our Central Conference. And Cohort 3 represents our Eastern Conference. We are so proud of the growth each of you have shown and cannot wait to see all of your hard work today. We are also honored to introduce our distinguished judges, representing diverse regions across the United States. Representing the Western Conference, we have Jackie Luong, who is a leading epidemiologist at the CDC National Center on Birth Defects and Developmental Disabilities. With a Master's of Public Health from Emory, Jackie brings expertise at the intersection of maternal and child health, chronic disease prevention, and data modernization. For the Western Conference, we also have Kiana Zagari, who is a Master's in Medical Sciences candidate at Boston University. She is a clinical research associate at both the Brigham and Women's Hospital and Dana-Farber Cancer Institute. As a passionate advocate and scholar, Kiana has led ovarian cancer efforts before the Los Angeles City Council and now currently conducts cutting-edge research in onconephrology research, investigating how acute kidney disease intersects with critical illnesses in cancer care.
Reagan Smith is a graduate nursing student at Vanderbilt University and a proud alumna of the University of South Florida, where she earned her master's in medical sciences. With a strong background in OBGYN clinical research, Reagan is deeply committed to addressing racial and ethnic disparities in women's health, particularly those impacting women of color. She is invested in advancing equity and culturally sensitive care. Vivek Srijit Kumar is a doctorate in medicine candidate at George Washington University and an emerging leader at the intersection of data science and public health. He has conducted impactful research modeling COVID-19 transmission trends across Florida and is driven by a vision of leveraging AI and data-driven insights to shape public health strategy and health policy leadership on a national scale.
And finally, representing our Eastern Conference is Kiki Fagum, a Master's of Public Health candidate at the George Washington University, specializing in health technology and in informatics. With hands-on experience in translational laboratory research for the development of HIV and novel COVID-19 vaccines, Kiki is passionate about the intersection of science, technology, and policy. She plans to attend law school to pursue a career in health policy and patient advocacy. Our second judge for this conference, or for this region, is Jordan Chambers, a Master's of Public Health candidate at George Washington University, concentrating in community-oriented primary care. With a strong commitment to addressing rural health disparities, Jordan takes a deeply community-centered approach to tackling today's most pressing public health challenges. We thank all the judges for offering your time, insights, and wisdom for our students today.
Now that you know the why behind Project Unity and everything that we do, it's the time we've all been waiting for. It's the time for the Innovation in Public Health Conference regional rounds. As you can see on the screen, our students are broken into different regions. In a moment, breakout rooms will be opened, and you may choose to attend any region to watch a presentation.
Great breakout rooms are now open. Students and mentors, please enter your specific breakout room now. Attendees, we encourage you to hop across different breakout rooms to hear from as many students as possible. The breakout room option is on the menu bar at the bottom of the Zoom features and can also be accessed by clicking on the three little dots on the menu bar and selecting breakout rooms. If you cannot enter a breakout room, please type in the Zoom chat what room you want to be in, and we will put you there. Enjoy!
Best of luck, everyone.
Each group had numerous projects to reach this point. These are 52 high school students across the country who have come together to innovate in public health. And while our judges make their final decisions, we would like to welcome our 2025 keynote speaker. We are now honored to introduce our distinguished keynote speaker for the 2025 Innovation in Public Health Research Conference. Please join me in welcoming Dr. Geeta Nayyar, a trailblazer at the intersection of medicine, technology, and public health. Dr. Nayyar is a nationally recognized physician leader who served as a chief medical officer at Salesforce and AT&T, where she helped shape health and safety strategy for millions and led digital transformation across clinical systems. She's also a best-selling author of Dead Wrong, Diagnosing and Treating Healthcare's Misinformation Illness, where she explores how misinformation threatens patient trust and how innovation must build it back.
Named among the top influencers in digital health, Dr. Nayyar brings deep clinical experience as a physician combined with forward-thinking leadership in AI, health equity, and system strategy. We're incredibly grateful to have Dr. Nayyar with us today to share her vision for guiding the next generation of leaders in healthcare and combating misinformation with integrity, innovation, and compassion. Thank you very much for taking the time to join us today.
You bet. Thanks, Pranav. Thanks, Morris. Can you guys hear me okay?
Yep, we're good.
Okay, great. Well, first of all, congratulations to all of you. This is a really wonderful community, and I'm just thrilled to see that the future of healthcare is in such good hands.
Thank you
So
so much for
congrats to all of you.
joining.
You look so young. You bet. You bet.
Yeah, thank you so much for joining. We can go ahead and start with our first question we have for you today.
Sure.
At Project Unity, we emphasize the importance of bridging multidisciplinary fields like medicine, digital health, and public health. You've been a physician, a tech executive, and a nationally recognized thought leader. Looking back, what inspired you to connect these three worlds, medicine, business, and technology?
Sure. So, you guys are still very young, but you'll learn that, you have a plan and then life has its own plan. So it was definitely not my plan. My plan was to go to medical school and become a doctor, and that was it. That was my plan. I'm a rheumatologist. My mom actually has a very rare autoimmune disease, which is how I ended up in rheumatology. But I happened to be in my training. I was actually in my residency at George Washington University, and I am the era of physicians that went from paper to digital in our residency. And I saw very quickly what paper could do versus what digital health could do. And I also saw the dysfunction between what technology was trying to accomplish and what doctors and patients really needed. And so I just found myself in a position to work on several projects, to really move several tech projects forward, not because I had any ambition or plans to end up in tech, but because I saw it as a way to improve healthcare delivery and improve just the life and the work of my patients as well as of my colleagues. And so I found myself very accidentally in health tech and digital tech, purely on my passion and purely because I just saw it. I saw what the power of it could be if done correctly from a physician's lens. Does that make sense?
Yeah, it makes beautiful sense. And it's also like so human that you talk about how it accidentally came about, right? A lot of times people don't necessarily know what the next trajectory is. And it's a lot of times it's you have to put yourself in different experiences and realize through experience that these are the problems. And when we talk about problems, like you're a very big thought leader in misinformation. Our conference theme this year is innovation in the age of misinformation. Could you tell us what are some of the most dangerous forms of medical misinformation you've encountered, Dr. G, and why are they so hard to combat?
Sure. Well, first of all, mis and disinformation is not new, right? So mis and disinformation has been around since the Black Plague. It is not a COVID issue. It is not a diabetes issue. It is just an issue in healthcare. Every one of you has different cultural backgrounds. Every one of you has a neighbor, a grandmother, somebody who has some sort of concoction that has told you, hey, when you're sick, try this, right? So that concept is not new in healthcare. I've said for a long time that mis and disinformation is like the boring beige white wallpaper in the hospital that we all know is there, right? We all understand it's there, but we don't really pay attention to it. But that wallpaper is now neon pink because of digital health, right? Because of AI, because of social media. It's now not just your grandmother and your neighbor telling you about these concoctions, but it's Dr. TikTok. Right. And Dr. TikTok has got some great dance moves, some really inspiring messages, and knows everything about you based on your search history and the algorithms that social media allows it to do. And so it becomes a lot more compelling, frankly, than your own doctor, right? Or your own healthcare experts, if you even can get access to a doctor, because that remains an issue in the United States, certainly. And so we really are dealing with a new competitor to science and trust in the era of digital health. And I think it's terrific you guys have taken this issue on because it is certainly not going away. It is only going to get worse. What the data tells us is that mis and disinformation is traveling 6 times faster than the facts because of this new era of technology and because we have a new consumer, right? We have a new consumer in a post-pandemic world that is hungry and thirsty for everything about healthcare that they can find. They want to buy a watch, they want to buy a ring. Everyone wants to be healthy. Nobody wakes up in the morning and say, I don't want to be healthy today, right? And so when someone on one of these social media platforms offers an alternative or offers something that seems simple, convenient, that one hack for just $9.99, subscribe here if you want to have more beautiful skin, you want to, stay young and be healthy. It's the new competitor for doctors and nurses and hospitals because doctors, nurses, and hospitals are really bad at communicating and really bad at even thinking about marketing and how to reach the consumer where they are. And so my challenge to you all as the new generation of healthcare leaders is we got to meet the consumer where they're at. We can't just stay in the hospital and talk to each other. If we really want to make an impact in people's lives, you got to meet the everyday person on the street, in the gym, wherever they might be, at the beach. It doesn't matter, but that's the new competition for science, period.
That's such a good point, especially because as clinicians, we're not trained, or future clinicians are not trained to how do we combat misinformation. And now this is a new duty that's being added onto a physician's responsibility. I think that really leads beautifully into our next point that your best-selling book, Dead Wrong, which I highly recommend all of you get and read, has sparked a national conversation about how misinformation is harming healthcare. And what made you, from your perspective, say, I need to write this book right now? Because as you said, misinformation has been around in healthcare for so long, but for your reason, you picked this moment to write this book.
Sure. Well, I'll tell you, and thank you for that. The book actually starts out with the very first patient that I took care of during the HIV/AIDS era that died on me. And it's a patient named Jerome. It's chapter one, not to spoil it for anybody. But really, Jerome was one of many patients that I took care of that really were just so and disinformed about HIV/AIDS, and just consistently the stakes were really high, right? You guys were not certainly around during the HIV/AIDS crisis, but it was very similar to the pandemic in that mis and disinformation was strong, was more pervasive than the facts. There was a lot of stigma, and the stakes were really high because if you got the facts wrong, you died, and you died a really terrible death, in fact. And so I decided to write the book. The book was always kind of in my head, but I had never really kind of put forth the time, energy, or expense of doing it. But, COVID really brought it back for me. And I remember telling our medical students and residents that I work with at University of Miami, we gave them kind of the same speech that was given to us during the HIV/AIDS era, which was, hey, this is a once in a lifetime public health crisis. You're going to be better doctors for having trained and lived through it. You're going to better understand public health, human nature, et cetera, et cetera. And I remember sitting in my office in March 2020 saying, but it was supposed to be a once in a lifetime crisis. And I already did that. Like, I already did that. Well, how are we right back here? And we didn't learn anything from it, right? And so my patient Jerome, basically till his dying death, and I saw him every morning for 6 weeks, and the entire time that I took care of him, he kept telling me that he was not a homosexual, he did not have AIDS, and I was a terrible doctor and I did not know what I was talking about. And so as we also think of the era that we're living in, of physician shortages and burnout, it's pretty demoralizing, right? As someone who has committed their life to science and helping people, to actually be helping someone that demonizes you and tells you terrible things. It's very hard to see patients like that pretty consistently. And that is unfortunately part of the contributor to burnout now for our staff, is it's not very joyful as a doc, as a nurse, to take care of patients that really don't trust you or resent you or are questioning your motivations and your intentions. So that's why I think this issue needed to come to light. That's why I wrote the book, because it was really meant to be an action playbook to say healthcare has to solve this. We have to solve this. No one is going to solve this for us. We can't ignore the wallpaper. It's too neon, it's too pink. And if we don't, your generation, unfortunately, are going to have to clean it up for us, because it is not going to look any better in 10, 20, 30 years unless we start getting the facts out there very intentionally, the same way that the misfits of mis and disinformation are. We got to do the same thing on the science side.
Dr. G, that's so touching, and that definitely must have been such an igniting moment for you. I, a lot of times you talk about health being human. Like a lot of times people view health as a data point, right? Especially when we're thinking from a systems level. Health revolves around like the finances of the country, all of those details. But you often talk about remembering that health is human. So can you give us advice for young people that we're growing in a hyper digital world where AI, social media, it's more pervasive and it can often replace human connection. So how do we find that balance?
Well, look, I think that's the era and the world that we're all living in. And I think it's something you have to be very intentional about. And I think we're also living in a time where health literacy is really important, right? So understanding, you all are very intelligent people, you're very motivated people, asking your own self, is what I'm reading, is what I'm viewing correct? Is it correct? And am I passing it forward? Because, if we just talk about definitions for a second, misinformation is actually just getting the facts wrong. It's kind of like a rumor. You heard this thing and you went on to pass it on, right? Whether or not you knew it was true. Disinformation is actually more dangerous, which is the intentional incentive and idea to manipulate for some sort of benefit, whether it's monetary, whether you're looking for more subscriptions, more likes, whatever it might be. But disinformation is what we're seeing as a machine that is out there really victimizing people. And so I think you have to ask yourself, am I part of the machine? Most likely on the misinformation side, which is, am I passing this video on? Am I sending this thing in a WhatsApp? Am I passing this thing on TikTok? That's actually not true, right? Or you're not sure if it's true. And I think as people who are interested in healthcare, asking the question, checking the source, being mindful of those things. And then on the flip side, looking at some of the things that are out there that are quite ridiculous and asking yourself, what could you do about it, right? How could you then debunk these myths or support those that are actually pro-science and pro meeting the consumer where they're at?
Yeah, those are amazing points. In fact, a lot of the students at the heart of their projects is this idea of disinformation versus misinformation, and what could they be doing now living in this hyper digital world. And so, as I talk about the students' public health projects, we have so many students here today who are designing their own public health interventions in the community. What's one piece of advice that you'd give them to ensure that they're not just building something smart, but something that really earns trust and works in real communities that need it?
Well, first of all, again, I love this. I'm so inspired by all of you. I think it's wonderful that you've taken on this initiative and just the group that you've created. Pranav and Morish is just really, really inspiring. I hope to have my daughter join you guys as well. What I would say is that don't get too sucked into the project. Zoom out for a second and ask yourself, would this work on me? Would this work on my family? Would this work on a family member who, only believes in ginger and garlic and never takes medications? And so asking yourself, what are the motivations? What is the human nature part to all of this? Because, ultimately, this is about being human. This is about inspiring people. This is about educating people as much as this is about digital health, it's also not about digital health, right? It's about finding a way to meet people where they're at, making them feel hopeful, making them feel inspired. And that's what the misfits of mis and disinformation have done so well. And science, we, for the most part, we talk from an ivory tower. We talk at a too sophisticated level. You got to make it simple, right? You got to keep it simple. And you really, to the extent you can really inspire people, I think that's important. And I think it's also about understanding spheres of influence. Big parts of the mis and disinformation battle happen in churches, they happen in communities, they happen through sports. So making sure part of your project is really that community engagement and partnering with those in the community who are inspiring, right? And there are those that identify in those circles that often don't have the science correct. And so, how can you reach out to those communities and be their partner in all things science? So digital is one piece to it, but I think really going out into communities, and it is the underserved, the Black and Brown communities that are more victimized by mis and disinformation because, frankly, the healthcare system has lost a lot of trust, right? And part of that's discussed in my book as well. The Tuskegee studies. I mean, these are all things that are really good reasons for people to not trust doctors and hospitals. And so understanding that to flip that switch takes time and meeting people where they at, and that a lot of the folks that spread disinformation are really good at this. They're really good at inspiring people and invoking a sense of identity, right? And I'll give you an example. If you're a good American, you will do these three things, right? If you care about X, Y, and Z, you'll do these three things. They have found a way to really help people identify with, well, that is who I am. I am a good American and I am someone who believes in X, Y, and Z. And so of course I'm going to do ABCD, right? And so I think that's what we in healthcare have not done well. But understanding that human piece is much harder than understanding the technology or the digital health components.
That is so beautiful, especially because at the end we're all creatures of emotion, regardless of how great someone's like service is. It all matters how well we connect with them, how well we understood, and that's why it's you bring up such a good point of not working for the community, but with the community, especially on these communities that have been historically left out, underserved, or harmed by the system. And so, what a phenomenal point. We want to as we get towards the end, we want to ask one question a lot of students have been asking us. You've been such a powerful voice as a physician woman, a female physician and an executive. What would you say to young women, young children, children of color, those who may just feel unsure about whether they belong in leadership roles or boardrooms? I know all of us have had doubts at some point, but what advice do you have for overcoming that, if that's there?
Sure. So first of all, everyone has doubts. It doesn't matter if you're a man or a woman, and I can tell you very confidently, being mid-career and reasonably successful in my life, you fake it till you make it. Everyone is faking it. Okay, but you do the best that you can. And don't always assume everyone knows more than you. That is actually often not the case. So the first person you need to have confidence in is yourself. But at the same time, being humble enough to learn and be from perhaps one of the biggest things you need to do, especially because you all are young. And secondly, specifically for the women and girls out there interested in healthcare, first of all, this is a business proposition. It is the women of the house, whether they are the mother, the sister, the partner, they are the caretakers of the house in every household, whatever that household looks like. It is always the women of the house making healthcare decisions for the children, for the elderly. So bearing that in mind, that is why having female leadership is so important in healthcare because we're ultimately the consumer. Even if dad is bringing home the health insurance, it is mom that is hiring and firing the nursing home, the pharmacy, the pediatrician, the cardiologist. Okay, so have the confidence in those numbers. But number two, I will be very candid with the young women on this call. You know, I finished all of my medical training and was about very close to 30 years old. You have to plan your personal life just as much as you have to plan your professional career. So being mindful if you have plans for having three kids, two kids, one kids, getting married, not getting married. These are all things you have to think about. And the first most important decision is what you are going to do with your education and your career. But the second one is who you decide to marry if you do decide to get married. And unfortunately, that is harder for women. And you need to make sure that your partner is supportive of a work-life balance and what that means, because it is impossible to do it alone. And I will tell you, I've met just as many men with unsupportive spouses. So it goes both ways. You have to be really sure of who you are, what you envision your life to be. Find the right is to be the CEO of X, Y, and Z, you know, have at it. But maybe having four kids is not the best plan, right? Maybe you need to think about having one or two kids or no kids, right? And are you okay with that? Right. And I'm being really candid because I see a lot of wonderful and bright, beautiful women, young girls on this call. And we don't do a good job of having these very honest conversations. And I will also tell you that I have a lot of successful female friends. My mom was a physician. My dad was a physician. Our house looked very different. It's very similar to my house does. But for a lot of my female friends who grew up with moms who were home, they had a really hard time hiring a nanny or getting help in the house. Whereas I always grew up with a lot of support in the house because that was the only way to make things work. And I'm one of three kids. So you have to really, really dig deep and understand what your life will look like and what you want it to look like and shape it very, very intentionally. But if you are going to be a professional woman, you're going to need a nanny. You're going to need someone to clean your house. You are not going to make every meal in your house. You need to understand that, and so does your life partner.
That is so beautiful. It's rare to get personal and life advice from healthcare leaders like yourself. And just bouncing off of that, I mean, if you could speak to your own high school self after everything you've achieved in your career, what would you say about the future of healthcare and what would be your place in shaping it if you were a high school student today?
Sure. Well, first of all, I wish I could join your group. I wish I was part of this community and it existed when I was in high school. So kudos to you guys. But, you know, secondly, what I would say is that healthcare, medicine, any part of the healthcare spectrum. It doesn't matter if you're a doctor, a public health person, an EMT, whatever you do in healthcare, healthcare is the best industry in the world. It is, to me, the best industry in the world because you can feel good about what you do every day. You can be inspired that you are actually helping and impacting people, and you can make a good living. And it's a very recession industry. It doesn't matter what happens with the economy or so many things. There will always be sick people, and there will always need to be people, our communities get stronger. And fundamentally, the world stops without your health. And I mean, I don't need to remind you all during COVID that everything stopped. It didn't matter what happened with the stock market. It didn't matter what happened in other industries. The world needed to be healthy and to get back to living. And so it actually is just the most inspiring industry and profession to be in. I think the other piece of advice I would have given myself is to slow down and enjoy it a little bit, right? Enjoy it a little bit because you blink and you're in the next chapter of your life and you become responsible for children and families, your own family. So while you are young and single, enjoy every moment, be curious, again, be confident, find yourself and find your confidence, but always being humble. And I think the word is curious, always being receptive to learning, not always having the answer is also important. And to travel the world, because here's the thing about healthcare, we do it very differently all around the world, but it is the great unifier for all of us. It doesn't matter what part of the world you're on. If you talk to anyone about a sick child, a sick mother, a sick sister or brother, there's something very universal about our health. And so I think also studying healthcare at a global level and understanding there are different ways to do different things. And perhaps as we shape healthcare in the United States, there are some things we also can learn from and be curious from other countries.
That's beautiful, Dr. G. It's so great how you talk about the human side of it. All of us in this room are so ambitious and we always try to have the answers to, oh, I need to do this, I need to do this, but we often forget the process that you mentioned. And it's the process that it's a journey that makes the destination worthwhile. And so that's so like inspiring hearing it from you, and it's definitely something that we can try to convey into our own lives. For everyone here, Dr.
I
G's
have, I
message
have,
is
I have, I have, I have one piece of advice if I can also add, and thank you for the claps and the emojis and all the things you guys do. I appreciate it. My daughter would love this. My other piece of advice, again, to the boys and the girls on this call, you've got to find mentors. And that doesn't need to be one mentor. I have mom mentors, I have tennis mentors, I have tech mentors, I have business mentors. Have as many mentors as you can. Start in your own high school, find the kids who are 2 years older than you and 4 years older than you, and then also look down and help the kids under you. Karma pays it forward, right? We all have to help each other, and what goes around truly does come around. And so making sure you are very intentionally finding mentors. If there's anyone that inspires you or you think you want to do what they do, send them a note and don't ask them for an hour. Don't ask them for 30 minutes. Ask them for 10 minutes to talk about themselves. And whether that's on a Zoom over a cup of coffee, and show up, be on time. Don't take more than 10 minutes. Respect their time, but make it about them. It's very difficult. I mean, my gosh, Pranav and Morish, I can't even tell you. I'm here in St. Augustine working. It's my husband's birthday. We're between a lot of different things. It's very difficult to say no to these guys, right? Because we all ultimately want to help each other and help the next generation. And you would be surprised. So don't be afraid to ask people to mentor you. It doesn't have to be a big commitment. Make it a 10-minute meeting. And if it leads somewhere or it's useful, you'll ask for another 10 minutes. All they can say is no. I mean, all they can say is no. I mean, Morse must have sent me like, I don't know, 10 text messages. By the time I finally answered him, we got to yes, right? I was like, no, no, okay, all right. Can we do it here? Can we do it then? Do you care if I'm on Zoom? I mean, all the things. So it just make it easy for people to say yes, but also don't be afraid if they say no. Just move on. Just move on.
phenomenal, actionable piece of advice. Like actionable, they're very amazing. Dr. G's message is incredibly relevant, especially as we think about the future of healthcare in an era defined by misinformation, mistrust, and rapid change. She's, as you can tell, and see, she's one of the most influential physician leaders in the country, but she's also a phenomenal human. And her work continues to shape how our current generation is going to integrate innovation, digital health, and equity into real systems transformation.
And we apologize to your husband, Dr. G. Thank you so much for taking time out.
Yeah.
Stu, they said happy birthday. I will convey your wishes. It's waiting for me. Thank you
Yeah.
guys. And please
And
find me on LinkedIn, Instagram, anything I can do to help your community. I'm rooting for all of you. You're going to go on to do big things and run things. And you guys all look like you're on CNN. I just love this background. It's the cutest thing.
of course, of
Thank you
course.
so much, Dr. G.
And we wanted to say thank you so much for leaving us with so much to reflect on and not inspiring just this cohort, but all of us in the room to lead with clarity, empathy, and courage. We can't express how valuable this type of opportunity is to learn alongside you this early in our careers for the Project Unity community. And so we just want to ask everyone in the audience while we have you here for a minute, would you guys want to see Dr. G again at, let's say, sometime again in Project Unity or sometime next year in the coming years for Catalyst Academy? Would you guys want Dr. G there?
You guys are, this is the peer pressure. See these guys, you can't say no to these guys. That
Dr.
was a
G,
slick move, Pranav. Slick
Dr.
move.
G, the students have answered, and so welcome officially to the Project Unity family. Welcome.
Oh, thank you. I'm so blessed. I'm so blessed. You guys are great. You really made my day. Thank you so much. Really appreciate it.
Have a good day, Dr. G.
All right, you guys take care.
You too. Bye-bye.
Thanks for having me. Bye.
Amazing. So that was an amazing talk from Dr. G. Very inspiring, as all of you can tell. She's one of the biggest influencers in healthcare misinformation and disinformation right now. And she's a mentor for all of us on how to lead with empathy, lead with dignity, and lead with impact going forward. So I know everyone has been waiting for our judges' decisions for the regional rounds. So we're going to be introducing our first judge for the Unity National Conference. Pranav, do you want to introduce Dr. Farkin?
Dr. Farkin serves as the Senior Vice President for Strategy, Community, and Business Development at the University of Maryland Medical Center in Baltimore. She leads enterprise-level strategic planning and oversees the hospital's community anchor mission, which drives equity-focused initiatives in community health, workforce development, and civic engagement to improve the quality of life for Baltimore residents. With over 30 years of senior leadership across the University of Maryland medical system, she's a widely respected expert in health systems transformation, strategic partnerships, physician outreach, and innovation. Dr. Firkin currently holds a Doctor of Public Health from the Morgan State University and a Master of Health Science and Health Policy and Financial Management from the Johns Hopkins Bloomberg School of Public Health. She is also a Fellow of the American College of Healthcare Executives and serves on multiple boards, including the Central Maryland AHEC, Vehicles for Change, and the UMB Cure Scholars Program, where she mentors the next generation of healthcare leaders. We're so honored to have her with us today. Thank you so much for joining us, Dr. Perkin.
Thank you.
Our next judge is Beverly Anili, who is a public health advisor at the Center of Disease Control, CDC, where she serves as a science coordinator in the Office of Public Health Law Services. She plays a pivotal leadership role on the Public Health Law Science team, helping shape the national landscape by integrating legal and policy tools to modernize public health systems and enhance population level impacts. Previously, Beverly served as a coordinator of the CDC's prestigious Public Health Law Fellowship, a flagship training program for early career professionals seeking real-world experiences in public health law and policy. She earned her Master's of Public Health from Thomas Jefferson University and is a passionate advocate for evidence-based policy, implementation science, and community-centered research. Beverly is widely respected for her ability to bridge science, law, and advocacy in the pursuit of sustainable, equitable health outcomes. We're thrilled to welcome her expertise. Thank you for joining us, Beverly.
Thank you so much.
And the last judge that we have is Miss Andrea Medeiros. So Miss Medeiros serves as the Vice President of Public Health and Policy at the Bone Health and Osteoporosis Foundation, where she leads a national portfolio encompassing education campaigns, health advocacy, and legislative engagement through the National Bone Health Policy Institute. She also oversees program analytics, outcome measurement, leveraging data and digital tools to drive cutting-edge evidence-based public health strategies. With more than a decade of leadership at BHOF, Andrea is a nationally recognized voice in public health innovation, health communication, and digital transformation. She holds a Master's of Public Health from Nova Southeastern University and is a certified health education specialist. Andrea is a longtime leader in the American Public Health Association, having served as past chair of the Public Health Education and Health Promotion section, completed 2 terms on the APHA Education Board, and currently serving as co-chair of the Communications Committee for the Latino Caucus for Public Health. We are excited to celebrate her leadership and vision. Welcome, Andrea. So please join us in welcoming all of our amazing judges. So the ground rules for the national conference are a little bit different. Participants will have 10 minutes to present, followed by a 5-minute Q&A where you, the audience, can ask a lot of questions. Please cheer on all the participants and their hard work. These are among the top innovation pitches across all the regional rounds, and we are beyond excited. So without further ado,
Our first national qualifier for the Unity Innovation Public Health Conference is the GUTS Initiative. So the GUTS team, if you can unmute yourselves, share your screen, and go into your presentation. That would be great.
Thank you so much. Yeah, we'll get started. Okay.
Should we do like a countdown or something like that?
You can go ahead and get started.
Okay. We're the GUTS Initiative, and we stand for gut.
Understanding.
Treatment.
And support.
I'm Shankar. I go to Stevenson High School.
Hi, I'm Yichun from the Illinois Mathematics and Science Academy.
Hi, I'm Sridev. I go to Little Rock Central High School.
And I'm Lily Wang, and I go to North Penn High School. Let's jump right into the background. To begin, inflammatory bowel disease, or IBD, is a chronic autoimmune disorder characterized by inflammation of the gastrointestinal tract. The condition diverges into two primary states. One is ulcerative colitis, and the other is Crohn's disease. As of 2019, the US age standardized incident rate for IBD was 4.5 times higher than global averages. This is a pertinent issue in Chicago, Illinois, with the local average being 117 cases per 100,000 people. This can cause numerous deaths and major life complications. The problem is, without IBD being highlighted, the IBD prevalence rate would increase and become even worse. So with GUTS, our objective is to reduce this prevalence in underserved communities in Chicago. Now let's move on to our methodology. In total, we utilize 22 sources, making sure to stick primarily to scientific journals, such as PubMed. Furthermore, we looked for our stakeholder through local universities, eventually deciding on Dr. Sharma, a professor who specializes in IBD treatment at Northwestern University. Reviewing our expert opinions and relevant sources, we finalized this very poster in the hope of educating the public on IBD. And when designing our plan of action, we had to first pinpoint our target audience. These would, of course, include the affected individuals of Chicago. However, within this, we found that much of this population had barriers that would need to be addressed. Specifically, many individuals lacked access to proper gastroenterology care due to cost and location. As such, this became a part of our target location. Further research, we also discovered that due to income, many struggle with financing care, insurance, and housing, realizing that this population is at the greatest risk.
So at the culmination of our research, we realized that Black and Hispanic adults aged 24 to 45 were the best candidate for our target population. And this is because they had hospitalization rates for IBD 30 to 40% higher than other demographics. And this also influences the choice of our neighborhoods that we're targeting, which we'll talk about soon. So for the city-focused literature findings, as we mentioned earlier, IBD is a very big problem in Chicago. And the neighborhoods most affected are Inglewood, Austin, and West Garfield. Now we'll talk about the individual neighborhoods in a second, but some of the factors increasing the likelihood of IBD are genetic mutations, a diet of highly processed food, and stress. And so many in these neighborhoods, since these neighborhoods are made up of lower income residents, they don't have as much access to care. Since Chicago is a historically redlined city with neighborhoods based on ethnic minorities receiving much less support compared to those without, these neighborhoods of Inglewood, Austin, and West Garfield have much less support services. And so there's a lot of food deserts there, meaning that healthy grocery stores are very limited. So the population relies on highly processed food. Furthermore, many lower income residents have to work 2 or 3 jobs, which leads to a lot of stress. And so genetic mutations, highly processed food, and stress all lead to inflammation and can lead to IBD flare-ups. So our stakeholder was Dr. Sharma. His lab focuses on regenerative medicine and Crohn's disease. So he is working on a treatment for targeting specific parts of the body that have IBD infections, and he is using nanoparticles to do so. So now I'll move it on to Atrin to do the plan of action.
Thank you, Shankar. Let's talk about the first phase. GUTS will meet with experts and gather data on IBD hotspots in Austin, West Garfield, and Inglewood. We will also host neighborhood listening sessions to hear directly from residents about IBD knowledge, stigma, care access, and food challenges. In phase 2, GUTS will partner with groups like Esperanza, Erie, and the Crohn's and Colitis Foundation. We'll launch small local campaigns like food tables at block parties and a multilingual public education push with social media, flyers, and videos. In phase 3, will host gut-friendly cooking workshops using SNAP-approved culture-relevant ingredients. Guts will also distribute IBD kits and run a month-long anonymous IBD survey. In Phase 4, we will work with CPS schools to share IBD tips for teens and launch a student ambassador program. In Phase 5, Guts will host a Gut Health Month with fairs, food demos, and IBD mental health workshops. We'll launch ongoing support groups and collect feedback through community surveys. Alongside our action plan, Guts developed a free IBD website designed for mobile use, multilingual access, and practicality across neighborhoods. The site includes a growing library of gut-friendly, culture-relevant recipes, a directory of GI clinics across Chicago, clear, simple IBD explainers for patients and families, and a calendar of upcoming events, workshops, and support groups. Furthermore, our website has various computational tools to help users, such as user analyst dashboards, interactive filtering, live map overlays, and dynamic feedback forms. We are finishing up the English version and are currently translating the site into Spanish, with future plans for additional languages. The goal is to break language barriers and make IBD education accessible, not just locally, but nationwide. We're also collaborating with Key, an intern at Project Unity who worked on type 2 diabetes outreach in Virginia. Their team is helping us expand recipe offerings and co-create educational content that bridges IBD and nutrition, building a foundation for a national awareness around gut health and diet-related conditions. Now, I'll pass it on to talk about the quintuple aim.
So the quintuple aim is essentially a five-pronged approach at targeting specific diseases. And so it consists of improving population health, enhancing the patient experience, reducing costs, improving providers' experience, and advancing health equity. So we're going to reduce the incidence or new cases of IBD in underserved communities in our target population by screening these high-risk groups early. We're going to deliver personalized care to the patients in lower-income communities. We're going to lower healthcare costs by subsidizing partial amounts of the cost of healthcare for IBD, and we're going to move to proactive rather than reactive care through these screenings. We're also going to support gastroenterologists and reduce the paperwork that they have to go through. And finally, we're going to have brochures and social media campaigns in different languages, as well as our website, as Adrian mentioned before, to bypass the language barrier. So I'll pass it on to Sridev to continue with the strengths and limitations.
And now that we have an understanding of what the Guts Initiative plans to do, I'll go over some strengths and limitations of our initiative. So first, some strengths are that it incorporates multilingual content to ensure everyone can understand what IBD is. And it's also very easily adaptable to different audiences and other cities like Philadelphia, where the IBD prevalence rate is very high. And this plan of action not only addresses the medical needs, but also the social and psychological needs to ensure that people who are struggling with IBD are not alone and can feel like that they have a place to connect with. However, some limitations of the Guts Initiative is that limited funding can make the events very hard to conduct. And therefore, to mitigate this, we plan to look to our stakeholders to provide funding. Another limitation is that the initiative depends highly on community participation, as without the community, the initiative won't be able to work properly. And therefore, our initiative plans on improving health literacy first of IBD so that people understand what its prevalence and why it's important to come out and support. And so in conclusion, IBD is a very significant public health concern, which is not treatable, but very preventable. And therefore, if it is left ignored, the IBD prevalence rates are intended to increase drastically. And therefore, the Guts Initiative plans to create interventions that will plan to increase health literacy so people will be able to identify IBD early signs and be able to get treatment for it early before they get worse symptoms, increase equity for everyone to have equal access to support and knowledge, and finally, to create support groups to ensure that everyone can get adequate support and won't feel that they're alone in their battle. And if this is continued in the future, studies can be conducted on finding the root causes for the rises in IBD prevalence rates, such as environmental factors or the specific type of diet that leads to an increase in IBD rates. And another future study that could be conducted is creating newer initiatives. And so this can be something like creating a new mobile app to increase health literacy even more. And finally, we would like to thank Project Unity and our mentor Jay Aditya Modak for assisting us with our product. And we'd also like to thank our stakeholder, Dr. Sharma, for taking the time to provide his invaluable perspective for IBD. And we'd also like to thank all the judges and the audience for coming out and being able to listen to us today. Thank you so much.
Thank you.
Thank you.
What an amazing presentation and a strong start to the national conference. It makes us so proud to see students at this age able to articulate innovative thoughts to such detail when planning the future of public health. And so, great job. Now we are ready to announce our second national qualifier for the Unity Innovation in Public Health Conference. We're going to build a little bit of suspense.
Before we get to that, we can start our 5-minute Q&A for the GUTS initiative. So if anyone has any questions, please feel free to raise your Zoom hand. And we will get started with Rami.
Yep. Thank you guys for the impressive presentation. So you guys said like innovations are harmed based on Dr. Sharma by pharma companies. So how is this being done? And how is Dr. Sharma's approach like more beneficial?
Yeah, thank you so much for your question. So basically, Dr. Sharma, his lab is working on regenerative medicine and Crohn's disease. So essentially what he's doing is using nanoparticles, he can target specific parts of the body that have IBD infections. And before he said that this was a challenge. And since his lab is working on it right now, they hope to roll out treatment after clinical trials are done and it gets FDA approved. However, he also said some of the limitations were that big pharma companies preferred the current treatment and are not as responsive to new treatments in the market. So he predicts it'll take longer for it to roll out.
This is also groundbreaking, if anything, because the main treatment with IBD is immunosuppressive therapy. And the problem that comes with immunosuppressive therapy is that it targets your T cells, which are I would say, they fight diseases for you. So if you target those, then you have a weaker immune system. However, with this targeting aspect, you can get rid of the IBD without destroying your body in the process.
Thank you a lot. Such a very valuable response.
Vincent, go ahead with your question.
First of all, great presentation. It's pretty crazy to see how far we've come as students. But to get onto it, I do want to ask. I did notice that for your plan of action, you guys had already gotten started with a website, and I just wanted to ask, how did you guys come about the idea, and what did you guys include in your like the start of your digital profile for this initiative?
Yeah, Adrian, do you want to answer this question?
Yeah. Thank you for that question. We kind of came up with the website kind of a spur. It was kind of in the beginning of the entire program. We kind of thought that a lot of the times surveys are a really great thing to have, but I find that not a lot of people fill them out just because there isn't really an incentive to. And I figured that, okay, well, I want to make something that's interactive, something that's great, and something that can be easily accessible no matter where you are. So we all collectively came up with a website. Although it's not done, we're currently working on multiple languages. And some things we figure out that is super helpful for users is as I mentioned, the user analytic dashboard, and it basically tracks which neighborhoods are engaged with most of which content. Example of recipes versus clinical maps. We also have interactive filtering. I found that a lot of websites, when I go on them, they don't have this in-depth sorting mechanism. So for us, we really wanted to have that. So for example, users can sort recipes by dietary restriction, cultural background, or ingredient access, such as is it SNAP accessible? Is it lactose free, halal, etc. We also have a live map overlay, which basically combines IBD care locations with public transportation lines and food access points. Chicago is well known to having their accessible public transportation. So having this specifically in Chicago and having this be readily accessible, you can go and see, okay, do I have public transportation around me? Like, what is the pathway? We also have dynamic feedback forms. So, as I said before, we also have surveys, but this is tied to a backbend database, allowing us to basically visualize gaps in knowledge and clinical access, and also language coverage in real time. So, I felt that all four of these aspects of our computational tools will really make us stand out when finalizing and publishing our website for anyone, not just Chicago, but anyone to use. But thank you. That was a really great question.
Wow,
And
that's
now we'll
amazing, and thank you for sharing.
and now we'll allow the judges any chance if you have any questions or anything that you want to clarify with the Guts Initiative.
No questions at this time. Thank you.
Same here. No questions here, and great responses to those questions there.
No questions either.
Sounds great. Phenomenal job, the Guts Initiative. Great job articulating your your presentations and inspiring what the next generation of public health can look like. Our second, now we're very excited to announce our second national qualifier for the 2025 Unity Innovation in Public Health Conference, Project Relief.
All right, perfect.
Yes, yeah. Please take a moment to share your screen, and whenever you're ready, we'll go ahead and start.
Hello, everyone. We are Project Relief, which stands for Recognize, Empower, Listen, Intervene, Educate, and Foster for Anxiety and Stress Disorders. To introduce our team, my name is Ruhika Panam.
My name is Ariana Mahadio.
And I'm Sonia Sharma, and we all go to Monte Vista High School.
Unfortunately, our fourth member, Isabel Benai, was not able to make it to the conference today. Let's begin. Our research team focused on generalized anxiety disorder, which we will be referring to as GAD. GAD affects 5% of adolescents in the US, but in San Diego, that number jumps to around 1 in every 8 youth. Despite this prevalence, 80% of affected youth never receive needed treatment due to barriers such as stigma, lack of awareness, limited access to resources, and scattered care systems. And untreated anxiety costs our nation a staggering $280 billion annually in healthcare burdens and lost productivity. This isn't just a mental health crisis, it's an urgent public health and economic priority. So, our research question to address this is what barriers prevent teens in San Diego from accessing existing mental health resources, and what are the most effective solutions to this? Our target population consists of teens aged 14 to 18 in San Diego, with a special focus on low-income youth. Our choice of the target population is based on national data, since 1 in 3 US teens will experience an anxiety disorder before reaching adulthood. Teens with untreated GAD are at higher risk of developing depression, academic difficulties, and social struggles. Addressing GAD early helps break this cycle and gives them the tools needed to thrive. Our choice to focus on San Diego is backed up by local statistics, as Latino students report the highest levels of emotional distress at nearly 40%, and 1 in 4 teens in the region report feeling persistent sadness or hopelessness. By focusing our intervention here, we're targeting a group that is both highly impacted and underserved. Moving on to our methodology, we conducted a literature review of 28 sources on the prevalence, outcomes, and access barriers of GAD among US and San Diego teens. In addition, we interviewed 2 local stakeholders to gain real-world perspectives that helped us identify barriers. Now I will pass it on to my team member Ariana to continue with the literature findings.
Thank you, Rahika. So nationally, GAD affects 10 to 20% of US teens, with rates especially surging during post-pandemic years. Additionally, female and low-income teens are found to be disproportionately impacted the most, and fewer than half diagnosed with GAD utilize the treatment in order to address the barriers that were previously mentioned. In San Diego, Latino and LGBTQ plus teens report the highest anxiety rates. 74.5% of teens link anxiety to sleep deprivation, and 82.3% blame academic stress and competition among peers as a trigger for their anxiety as well. critical shortages of school counselors in San Diego's public school system, currently with one counselor to every 714 students versus the recommended at one counselor to every 250 students, leaves hundreds of teens without proper emotional support. For our stakeholder insights, we interviewed two key experts. First, Dr. Danny Shire, an adolescent psychologist who noted that while GAD rates are increasing, overdiagnosis may blur the lines between normal stress and clinical anxiety. She emphasized that stigma often stops teens from seeking help, and she recommends in-school support and visual tools in order to improve access. And for our second stakeholder, Miss Alex Swanson, who's a program manager at Sunny Days nonprofit, highlighted barriers for teens in low-income areas, including stigma, limited access to phones, internet, or transit. She suggested incorporating nutrition, nature, and grounding tools into our platform to better meet teen needs. And for our plan of action, we wanted to structure it into 4 phases. From phase 1, from August to October of this year, we want to focus on development and setup. During this stage, we're aiming to build a culturally responsive website platform that compiles mental health resources. We're hoping to partner with local organizations like NAMI San Diego, Project Unity, UCSD, and the San Diego Unified School District. Additionally, we're recruiting 15 to 25 teens to receive youth mental health first aid training so that they can serve as digital navigators on our platform. And before launching, we'll aim to gather feedback from at least 3 partner organizations in order to refine our platform to be as efficient as possible. For phase 2, from November to January, we want to move into pilot testing and outreach. We'll officially launch our platform and try to collect at least 50 user feedback responses in order and also certify our digital navigators. Outreach efforts will include school visits to at least 3 school districts with a focus on at least one underserved community, as well as promotion through social media. For phase 3, from February to April, we're focused on evaluation and expansion. We'll track site usage and collect another 50 feedback responses using this data to guide platform improvements. We'll also plan to train an additional 20 to 30 digital navigators and gather feedback from at least 10 current navigators in order to improve training quality and overall training impact. And finally, for our last and final phase of our plan of action from May to July, our main focus is our sustainability. We'll transition to school-based clubs, expanding outreach to at least 4 counties in California. We'll try to host biannual navigator check-ins and continue training 30 new navigators each school year. Community outreach will expand to at least 5 underserved schools in San Diego, and ongoing feedback will guide platform updates to ensure that our platform remains effective and useful. Now, I will pass it on to my team member Sonia to continue with the presentation.
Thank you, Ariana. Our solution is unique in that it is cost-free, culturally responsive, and consolidates all resources in the area in one place. This addresses gaps identified through research and stakeholder insights, particularly the limited access that low-income communities have to existing services. Another barrier is the lack of awareness of available resources. To tackle this, we're introducing teen digital navigators who help youth access our platform and learn about existing tools. A potential challenge is low awareness of our intervention, which we aim to overcome through these navigators providing information to their communities. The final barrier is the possibility of our intervention not reaching marginalized communities. To combat this, we'll recruit navigators from diverse regions across San Diego. Now let's move on to the quintuple aim. Our model improves population health in that digital cost-free platforms increase early intervention and reduce the long-term consequences of untreated GAD in marginalized communities. Second, we enhance patient experience because our platform has multiple languages in order to provide culturally competent care and allows users to filter through providers by age, gender, and ethnicity. We reduce cost because preventative digital health decreases the likelihood of ER visits and inpatient care. We improve healthcare provider experience in that our platform and navigators give youth a place to go for information, taking some of the burden off of healthcare providers and decreasing backlog and burnout in the healthcare system. Finally, we advance healthcare equity by having multiple languages available and having a platform that's free of charge. This is especially significant in that low-income populations were identified by our stakeholders as the group with the most barriers to accessing resources for GAD care. Now I will play a video of our final member, Isabel, as she could not be here today. Okay.
Hello everyone, my name is Isabel Benai, and I'm the fourth member of the group that is researching GAD. I'm from San Diego, California, and I attend the Bishop School. Today, I'll be going over the conclusion, acknowledgement, and reference portions of our poster. So, in conclusion, 1 in 8 teens in San Diego experience GAD, with low-income youth being most at risk. Barriers like stigma, language differences, and lack of culturally sensitive care often keep them from seeking this kind of help. Our intervention tackles these challenges in 2 ways. We will train digital navigators, which are peers certified in youth mental health first aid, to connect classmates with the right support. We're also creating a digital platform that organizes local resources by language, culture, and service type. Together, these strategies aim to reduce stigma and make help much easier to find. Now, to show some gratitude to those that we could have not done this without. We thank our mentor, Olivia, our stakeholders, Dr. Danny Shire and Ms. Alex Swanson, and the whole Project Unity team for their endless support. Thank you so much for listening, and please scan the QR code for references or any type of question. Thank you.
All right, thank you so much.
Thank you.
What an amazing presentation. Digital navigators as students. I would like to open up the floor for questions for this group. Any audience members or judges, please. I have a question for your group.
All right, go for it.
When you talk about training digital navigators, what happens to students who don't have access to Wi-Fi, right? Because the core component of digital navigators is having access to Wi-Fi. How would you go about that?
Yeah, for sure. And I know that we definitely talked about sourcing digital navigators from underserved communities. So I think that the best way to go about this is partnering with school districts, as I know that especially post-pandemic school districts want their students to have access to these resources, and see if we can get them district devices, district Wi-Fi, see if they can do this training at school. Districts are typically very amenable to their students receiving training, especially in terms of mental health, because post-pandemic that's been a huge focus. So that's definitely a very valid concern, and I think partnering with those districts, which we did mention in our presentation, would be the best way to go about that.
Awesome. Any other questions?
I have a question. Can you just share with us what your ideas were around future research regarding this topic around digital navigators?
Yeah, around digital navigators? Okay, for sure. I know that when talking about future research, we definitely wanted to see which barriers were the most significant in preventing students from accessing GAD care, to see if there's any way that we can prevent those barriers from having an effect, so the effects of untreated GAD aren't as bad. In terms of incorporating digital navigators into that, I think that we would combine that with the research I just mentioned to see which areas have the most barriers and try to source digital navigators from those regions specifically to make sure that our intervention is impacting the students who need it the most and are most at risk of having untreated GAD.
Okay, thank you.
Thank you so much.
Thank you, Sonia. Any other questions from the audience, from the judges? Amazing. Thank you so much for presenting. We'll now move on to our final finalist for the national conference.
All right, thank you so much.
I'm not able to share my screen at the moment, but that was an amazing presentation, and it makes us so proud to see students at this age able to articulate such innovative thoughts for the future of public health. For our final initiative, I'm super excited to announce the MAMA initiative as our final finalist for the National Unity Conference.
Congratulations to the Mama Initiative. You're more than welcome to start sharing your screen, and whenever you start, we'll begin the timer.
Thank you. It says that I can't share this. Oh, never mind. Thank you. M. Sorry, can I start?
Yes, whenever you start speaking, the timer will start.
Okay, perfect. M.
A.
Mama, an intervention addressing maternal mortality in Clifton, Ohio.
Mai was 27, a new mother, a college graduate, and excited to start her next chapter. She gave birth to a beautiful baby girl, but just days after leaving the hospital, Maya died from undiagnosed cardiomyopathy. Her chest pain was brushed off as anxiety. Her nausea was deemed as a stomach condition. On top of that, Maya never received a postpartum checkup. Unfortunately, Maya's story isn't an outlier. It's a reflection of a public health system that continues to fail Black mothers. In the United States, a country with the largest healthcare spending per capita and cutting-edge technology, maternal mortality is still rising, and Black mothers are 3 to 4 times more likely to die than white mothers, even when controlling for insurance status, education, and income, according to the CDC. This isn't just a medical issue. It's a public health emergency rooted in systemic racism, unequal access, and social determinants.
My name is Devika, and my team members are Sophia, Jada, and Maria. We are a group of public health researchers through Project Unity's Catalyst Academy, and our mission is to take our learning beyond the classroom into communities. This project is our response to a crisis. Our solution? MAMA, Mobilizing Activism for Maternal Access, a community-focused intervention to save lives in Clifton, Ohio.
We began with the literature. We analyzed over 29 peer-reviewed articles and data sources like the CDC, NIH, Ohio Department of Health, and Cradle Cincinnati. We studied both national trends and local disparities. And here's what we found. Nationally, maternal mortality dropped to 18.6 women per 100,000 births in 2023. But for Black women, it increased to 50.3. Over 80% of maternal deaths are preventable, linked to hemorrhage, hypertensive disorders, and infection, according to the CDC. Black women often experience dismissal of symptoms, delayed care, and limited postpartum follow-up, causing this increased number. Locally, in Hamilton County, which includes Clifton, Black women are 2.5 to 3 times more likely to die during or after pregnancy, according to the Cincinnati Enquirer. Many live in maternity care deserts, which are counties across the U.S. in which access to maternity care services is limited or absent, and also face long travel times, limited health education, and culturally incompetent providers. Even in a medically dense county, barriers like insurance, racism, and transportation still persist. We interviewed leaders like Shanetta Cottrell from Hamilton County Public Health and Charla Hale from Healthy Moms and Babes. Their insight shaped our intervention. Cottrell emphasized how limited transportation and lack of social support create serious gaps in care. Her team connects women to local resources and pushes for more doula-friendly hospitals. Hale shared how their mobile unit brings prenatal education, case management, and long-term support directly into neighborhoods. Their success depends on strong partnerships and trust within the community. Both made it clear, to actually reduce maternal mortality, we need more than services. We need trust, mobility, and care that truly meets people where they are.
With all of this, we asked, how do we turn our insight into action? Well, the answer? Our intervention, a mobile maternal health bus run in partnership with Ohio Health's Mom and Babes Mobile Health Center and Hamilton County Public Health. The maternal health bus is the heart of our intervention. It serves as a mobile lifeline traveling all throughout Clifton to reach women in neighborhoods with the highest maternal health risk. But this bus is so much more than just a vehicle. It's a bridge to care. It brings essential services right to the doorstep of communities that need them the most. That includes free prenatal and postnatal checkups, screenings for high-risk conditions, lactation support, and health education workshops that are culturally informed and accessible. But what makes our model even stronger is who provides the care. Every service on our buses will be delivered by trusted community healthcare workers, which are people that reflect the identities and lived experiences of the women they serve. This helps build real trust, improve health literacy, and ensure that no mother is left behind, no matter her zip code, income, or background. And because this is a mobile unit, we're able to meet women where they are, literally and emotionally, by offering consistent, compassionate care throughout their entire pregnancy journey. We're also going to be introducing something new, our postpartum awareness bracelet designed by our team shown here on the screen. These bracelets help moms recognize red flag symptoms during childbirth, things like chest pain, extreme fatigue, or heavy building, and would encourage them to seek care early. They also send a very clear signal to providers: take this patient's symptoms seriously. A similar program done by USA Health led to a significant drop in maternal complications, and we aim to build on that success. To strengthen our system even more, we'll train local hospital staff to recognize the bracelets and understand what they mean. This would close the gap between mobile care and hospital care by creating a seamless network. So even if a patient moves or if care is interrupted, her needs stay visible and prioritized. And finally, we know that equity isn't just about access, it's about how that care is delivered. So through Mama Certified, which is an organization that works with hospitals to improve care for Black moms and babies, we would lead bias in healthcare workshops. This would help providers recognize and address their own biases, and these sessions would promote more equitable, respectful, and culturally safe care, especially for marginalized communities.
Our evaluation methods are simple and measurable. We'll track prenatal and postnatal appointment attendance, emergency visits due to preventable conditions, patient satisfaction, and finally, how many hospitals are adapting our bracelets. Our intervention also operates through the socio-ecological model. On the individual level, we address health literacy and risk factor awareness. On the interpersonal level, we provide support to families through resources and education. On the institutional level, we work directly with hospitals and clinics. On the community level, we bring care directly to underserved areas. And finally, on the policy level, we advocate for postpartum Medicaid extension and doula coverage. With the quintuple aim, a framework designed to improve healthcare, we improve population health, enhance the patient experience, reduce per capita costs by preventing readmissions, improve the healthcare provider experience by prioritizing bias training, and finally, advance health equity, our core goal. By prioritizing health equity, we reduce systemic barriers such as transportation, childcare, and work constraints. This promotes trust, autonomy, and a more inclusive care delivery.
We know Mama isn't a cure-all, but it's a start. One of our greatest strengths is mobility. By meeting patients where they are, we remove key barriers like transportation and limited clinical access. And when we do it while building trust, something traditional symptoms have often failed to do. Our postpartum awareness bracelets are another strength. They're simple, low cost, and designed to shift power. Mothers wear them, providers recognize them. Symptoms like chest pain, fatigue, and shortness of breath are no longer dismissed. They're seen and acted on. We also center cultural humility. Community health workers reflect the population they serve. Our bias in healthcare workshops don't just check a box. They challenge assumptions, spark conversation, and begin the slow work of shifting provider behavior. But we are clear about our limitations, such as policy gaps, like inconsistent Medicaid coverage and lack of doula reimbursement still threatens our access. Funding for mobile units isn't guaranteed long-term, and bias training alone won't undo decades of mistrust. But still, by combining care, education, and equality, Mama creates something rare, a model that is rooted in community, driven by evidence, and built to last. To bring it full circle, this project is for Maya, and for the many women like her, for the mothers who never got a follow-up, whose pain was ignored, whose lives were cut short.
As we sit here today, we're not just sharing research, but we're sharing responsibility. The maternal health crisis in this country, especially for Black women, is not a coincidence. It's the result of centuries of inequality, policy gaps, and a healthcare system that too often fails the people who need it most.
Maternal health intervention, we've built a model that's rooted in equity, community, and evidence. We've worked with stakeholders who've lived this fight every single day. We've turned data into direction and stories like Maya's into solutions. The bus, the bracelets, the bias training. Together, they form a public health ecosystem designed to restore dignity and save lives. Now, our call to you is this. Whether you're a future doctor, policymaker, activist, or community member, what are you doing to ensure that mothers like Maya are heard and protected? And we leave you with this. In a country with the highest healthcare spending in the world, why are Black mothers still dying? And most importantly, what are you going to do about it? Thank Thank you. We'd like to thank Project Unity and our mentors and our stakeholders for this amazing opportunity.
What a powerful end to 3 amazing presentations at our national conference. I am so glad, and I can speak for the other directors, that we are not the judges because this is such a tough decision to make. We will now take a 5-minute break to allow the judges to deliberate and make their final decisions before we move on to our awards ceremony, which we have so many amazing awards to give out to students. So we'll be back around 1:33, 1:34.
Before that, we want to go ahead and open it up to the audience. We want to open up for some Q&A. If you guys have any questions for the Mama Initiative. And also to our judges, if you have any questions or anything that the team can help clarify.
Yeah, this is Beverly. Sorry, I'm having some technical issues, but great presentation. Just a quick question about the bracelets. Could you clarify if those would be limited to the women in your target population, or if you were thinking of expanding it to women outside of your population as well?
So at first, we plan on focusing in Clifton, Ohio, because we want to test out our intervention and focus on building the issue there or fixing the issue there. And then we hope to partner with hospitals in the area for them to recognize the bracelets. And eventually we would like this to be nationwide as we expand to other cities. So we want this bracelet to be identified throughout the US, essentially.
Amazing. Thank you so much.
Thank you.
Dunker, you have a question?
Yeah, really great presentation, guys. I was just a bit curious because you mentioned that you guys want to expand to other cities. What other cities do you guys think most deserve this kind of initiative?
Well, we know that New York City has really high maternal rates. So it's quite bigger than Clifton, Ohio. So obviously we want to focus there in that county. But we would eventually like to go to bigger cities like New York City and other cities in the US with high maternal rates as we expand nationwide.
Thanks.
You mentioned in your presentation that the US spends the most per capita on healthcare. Why do you think, in your opinion, maternal mortality still remains such a big issue in the United States compared to other well-developed nations?
I would say that there's a lack of awareness and there's a big stigma around maternal and reproductive health. There's a lack of funding as well addressing maternal mortality. So I would say it's not a very known issue. I personally did not know about this issue before this program. So ensuring that just because we have a high amount of spending doesn't mean it's going into the correct issues that actually need it most. That's the same thing between equality and equity. We need to ensure that just because we are spending the same amount of money in every single issue, we need some more money for other issues like maternal mortality. So that's also something that we want to kind of raise awareness about, and maybe that'll be something part of our future initiative.
Thank you. Questions from other students, mentors, judges?
This is a phenomenal presentation. What do you think are going to be the biggest challenges to scaling? Like, could you elaborate a little bit more on that for us?
Definitely the biggest challenges will be implementing the bracelet system. Even though we are focusing on Clifton, Ohio, all hospitals run by different laws, rules, and management. So it's going to be very difficult to set that out there. But that's where we're working with different organizations like Healthy Mom and Babes and the Ohio Health Committee to kind of scale our impact. And again, the biggest thing to know is that changes are driven by data. So we're hoping that focusing in Clifton will allow us to get a good scale of what works and what doesn't. When we present this bracelet initiative to different areas across the US, they'll see our data and want to implement it in their hospitals too. I hope that makes sense for you.
Thank you.
Awesome. If we have no other questions, we will have the 3 judges meet in a breakout room. Justin and Pranav will be with you in the breakout room. And then all of us can reconvene in around 5 to 6 minutes to go through the awards ceremony. Thank you so much. And what amazing presentations. We're just in awe.
Please feel free to get up, take a stretch, get a snack. The best part is about to come, the moment everyone's been waiting for. So get ready. We'll meet around 1:36, 1:37. Okay?
CST.
Yeah. Yeah. Oh, sorry. Yes, CST. Yeah.
All right. It is 1:38. We will now proceed to our awards ceremony for the Project Unity 2025 conference. So we are thrilled to officially kick off the awards ceremony. This year, we welcomed 52 exceptional students from across the United States, showcased 13 bold and innovative projects, and collectively achieved over 1,200 hours of dedicated public health leadership. Today, we celebrate those who went above and beyond, the change makers who have left a lasting impact on this experience. But before we dive into our student awards, we would like to take a moment to recognize the unwavering support and inspiration behind the scenes. Our graduate and undergraduate mentors from top public health institutions from across the country. These mentors served as the backbone of the 2025 Catalyst Academy, guiding our students with wisdom, patience, and passion.
This year, we're excited to introduce a brand new honor, the Unity Excellence in Public Health Mentorship Award. This award recognizes a mentor who has gone above and beyond, who inspired curiosity, nurtured innovation, and truly empowered the next generation of public health leaders. This individual exemplifies what it means to lead with both heart and vision. And now, the 2025 Unity Excellence in Public Health Mentorship Award goes to
Ida
both.
Ryan and Diana Jacob. These two phenomenal mentors from the 2025 Catalyst Academy stood out as true exemplars of excellence, leaving a profound impact on their mentees through dedication, mentorship, and leadership. Ida Arian, an MPA student from George Washington University, demonstrated an extraordinary level of commitment to her mentees. She consistently went above and beyond, holding additional one-on-one sessions, meticulously reviewing drafts, and empowering her students to think critically and independently. Her mentees shared that Ida never let a question go unanswered and always encouraged us to aim higher. She fostered an environment of growth, accountability, and genuine care, shaping both the projects and the people behind them. Our second mentor award goes to Diana Jacob, an MPH candidate at the George Washington University. Brought structure, heart, and insight to her mentorship. She took initiative to schedule weekly check-ins, provide tailored guidance at every step of the research process, and helped her mentees stay motivated and confident. One student noted, Diana believed in our vision before we fully did. Her support made this truly meaningful. Her leadership created a foundation of trust, learning, and collaborative success. Ada and Diana, thank you for your unwavering dedication to your students. Your mentorship has built the future of public health, and we are proud to recognize both of you with the 2025 Unity Excellence in Public Health Mentorship Award.
Second award is the long-awaited 2025 Unity Public Health Trailblazer Award. As we come together to celebrate the future of public health, this prestigious award recognizes the individual who has demonstrated an extraordinary commitment to public health. This individual has not only excelled throughout their summer public health project, but they've also shown tireless commitment to public health these past weeks, a relentless passion to lead public health initiatives in their communities, sparked intellectual conversation with global leaders while providing support to their peers throughout Catalyst Academy. They've shown a constant drive to sharpen their professional skills. Their exceptional leadership in nurturing and growing Catalyst Academy sets them apart as a true trailblazer in the field. This summer, we were faced with an impossible decision across 52 students, but one student individual stood out for this honor.
Congratulations, Violet.
I am super excited to talk about Violet Sue as the winner of the Public Health Trailblazer Award. I also told Morris and Pranav that I wanted to announce that I wanted to announce the Public Health Trailblazer Award. So Violet, to me, five main qualities stand out about her. First, Violet's always stepping out of her comfort zone to fully participate with our guest speakers and mentors, provide answers to tough questions, ask critical questions herself to learn more about public health. I mean, she would ask questions that I would never think about to ask when it came to our guest speakers in our classes. Second, her support and encouragement toward her peers, both in her research group and in her cohort, is so reassuring, warm, and comforting. Third, she has this very infectious and just bright energy that never fails to light up a room and energize a crowd. I joke that perhaps she gets this from just being in the sun all the time in California. Fourth, I was extremely impressed by Violet's growth throughout the program. She started out this program, feeling a little bit nervous. But she embraced that initial discomfort and really transformed into someone with a true curiosity and a true drive to continuously further her knowledge in public health. Finally, and this is probably the most important thing to know about Violet, she not only provides the best classical music recommendations, but she also provides the best beef noodle soup recommendations and boba recommendations. So you can always count on her when it comes to everything food related. So congratulations, Violet Sue. I think you're smiling right now. Thank you all for your contributions to Cohort 1, your sickle cell disease team, and for growing the Project Unity mission. We were extremely proud to accept you into Catalyst Academy and cannot wait to see all the amazing things you'll accomplish in your career.
The Public Health Trailblazer Award is our most prestigious award. One student gets it every year, and for the past 3 years, Violet now being the third, these students go on to accomplish great things in their career. So we're super excited. Congratulations, Violet. We are now excited to announce our National Unity Innovation and Public Health Conference Best Research Paper Award. Alongside today's research presentation, each student created a rigorous academic research paper, including their scientific research on their public health issue, and a formal proposal to address this topic within a respective city. The Unity Best Conference Research Paper celebrates the group with the best overall research paper, factoring in their detailed research content, professional writing skills, critical thinking abilities, and overall scientific competency. So, congratulations to the amazing Breathe Initiative. Written by students Shreya, Akshita, Nihar, Jiffy, and led by mentor Michelle Saki. Congratulations to this talented group of individuals. Our judges read through 13 individual research papers. It was such a difficult decision to make, and the amount of effort and detail that you put into your research papers were just amazing. Congratulations.
Now, we are beyond excited to announce the next award of the afternoon, the National Unity Innovation in Public Health Best Innovation Pitch. This award recognizes the group that delivered the most compelling and engaging poster presentation today, factoring content, professionalism, and overall delivery, along with their ability to impact the community. We were in the breakout rooms, and our esteemed judges went through lots and lots of back and forth to finalize the winner. Before we get to the award, we would like to take the honor of listening to our prestigious Unity National Conference judges to hear what they had to say. Dr. Farrakhan.
Good afternoon, everyone. And wow, I am still in awe of what I experienced the last hour. Top notch. If I didn't know you were high school students, if I didn't know that, I would have said you were all well prepared masters and public health students. So congratulations on the presentations. All of them were outstanding. The command of the information, the knowledge, the innovation in your recommendations, and wow, you're ready to be on the national scene with what you've shared today. So congratulations to all of you.
I completely second that. We were just talking, that's what we talked about the whole time. It's amazing to see all the work you've done, and I can't wait to see what happens next. If you were here that level at high school, you can only go further and further, which is amazing. And I hope to see what you do in the future.
Yeah, I completely agree. You guys sound exactly like the people that I work with every day. So it's just incredible to hear that from you all, and so excited to see where you all end up. So thank you for sharing this all with us.
We were in the breakout room, and the first thing they asked, are you sure they're high school students? And that's just as a testament to show that this is from what you guys started off the first 8 weeks to now, it is beyond beautiful to see the evolution. And we want you to know that these three perspectives are coming from some of the top leaders in the United States, top healthcare leaders in the United States. And so you should feel confident and validated that you're on the right track and you're going to continue growing in the direction you need to. So huge congratulations to each one of you. And now, with that being said, the 2025 Unity Innovation in Health, Public Health Best National Innovation Pitch goes to the Mama Initiative, led by Carly Hughes and Alex Abramson. The Mama Initiative consists of Sophia, Uruguay, Miriam Azam, Jada Okay, and Devika Gidesh. Congratulations to all of you for all of your hard work. This was a very, very difficult decision, and you guys executed very well. All right, now we have something that wasn't on the agenda. This is something special, something that comes straight from the heart of Project Unity and our Project Unity community. For the first time, Project Unity is launching a tradition that reflects exactly what we stand for, building the next generation of leaders in public health and medicine. And when we say we're invested, we don't mean it through just words. We mean it in action. Because every once in a while, a leader comes in who doesn't just participate in the program, they transform it. And so tonight, it's my absolute honor to announce the inaugural Unity Outstanding Healthcare Leader of the Year Scholarship.
Let me take a moment to ask all of you here today, did you enjoy today's conference? Were you inspired by how seamlessly everything came together? Were you blown away by the confidence, creativity, and professionalism of our Catalyst Academy students? What you witnessed today didn't happen by chance. It happened because one extraordinary leader behind the scenes, someone who's worked tirelessly, relentlessly, and wholeheartedly to ensure that every single piece of this program has reflected excellence.
This year's Catalyst Academy wasn't just our best version yet, it set a new benchmark for what's possible when someone leads with heart, vision, and resilience. As one Catalyst student said, I kept messing up during my presentations, but he stood by me every time. He didn't rush me, he made me feel like I could do something I never believed I could, speak on the big stage. As a mentor says, he's one of the most poised and visionary leaders we've ever had the privilege of working with. His constant enthusiasm, unwavering support, and deep commitment to us as mentors inspired me to become the best public health leader I could be during Catalyst Academy. Our executive leadership team says, Justin is the reason Project Unity is going to the next level. He pushed us to think outside the box and reimagine what's possible.
Mr. Justin Chang, Project Unity Senior Director of Education, you are the first ever recipient of the Unity Outstanding Healthcare Leader of the Year Scholarship Award. We are awarding you a scholarship in support of your medical education, a small gesture to recognize the enormous impact you've made on all of us and on the future of public health. Justin, you genuinely embody the values that we strive to cultivate in every student who come through Project Unity. And disciplines that I want to embody myself, you make me a better leader every day. Leadership, discipline, humility, and a deep, unwavering commitment to the future of public health. You are more than a director, you are a visionary, a servant, and a role model to our team, our students, and to each of us.
Now, here's something you might not know. Justin's a first year medical student. And as a medical student myself, let me tell you, medical student alone is a very rigorous, consuming, and demanding training environment. It's long hours, but somehow, while navigating the intensity of his first year of medical school, getting into clinical training, Justin still managed to design, lead, and execute the entire Catalyst Academy from conception to completion. From August 2024 to today, August 2025, pouring over 1,400 hours into its success, into each and every detail you saw executed well today. And today we are proud to honor your contributions in a lasting and meaningful way. And so please, everyone that's here today, can we all take a moment now, wherever you are, to just unmute or in the chat, just unmute and give a huge heartfelt round of applause for Justin Chang, the person who made today happen. If you cannot unmute, please also send your kind words in the chat.
Congrats, Justin.
All right,
Congrats,
Dr.
Justin.
Justin.
As you can all see, Justin is very popular at Project Unity.
He's popular everywhere.
And so, Justin, the floor is yours. We'd be honored to just hear a few moments and some words from you.
Sure, I am not good at speeches, as you guys will soon recognize. But no, this is an incredible honor. I am so flattered to have received this. Pranav and Morris were like, there's a surprise, but they would not tell me what that surprise was. And I was like, tell me the surprise. Like, what's going on? I don't know, it's been such an incredible journey these past couple years. I mean, I don't know what to say. I mean, like, I joined I joined Project Unity last year as a mentor, found it so incredible. And I just wanted to learn more and continue to improve myself. And I have to say, like, I got so much help from all of you guys, like the executive leadership, the mentors, and all the students. All of you really like teach me to be like a better person, and to be a better educator. One of my big goals is to go into education and, really inspire people, whether it's, high school students, college students, medical students, to just have, that curiosity and drive to continuously innovate, improve themselves, and just be the best person they are. So this is very, this is very surprising, to say the least. Even though Farnab and Morris said that it was a surprise. So, no, I appreciate all of you, and thank you guys, honestly, for making Catalyst Academy 2025 such an incredible program to help lead and just be a part of.
Thank you, Justin. Now, as we near the end of the conference, you might be wondering what's next for Project Unity. Our 13 intervention teams are partnering with community leaders to bring bold ideas to life. If you would like to support or get involved, now is the time that we're launching Catalyst Academy 2026 next month. Join our mailing list to get early access for our programs or access to mentors that we bring onto the team. Project Unity 2025 is also honored to have been invited to present at the 2025 American Public Health Association National Conference in November. This November, we'll be teaching future leaders how to drive impact at the intersection of medicine, public health, and digital health. Visit our session and learn from top APHA healthcare experts from across the country. We're also launching the Youth Public Health Accelerator, where we'll be scaling student-led nonprofits nationwide with expert mentorship funding and monthly career plus public health workshops led by healthcare experts in the community.
So what makes Unity special? This special part is everyone has a role. Every single one of you in this audience can have a role. Students, healthcare professionals, community leaders, parents. If you care about impact, you belong here. And so stay in the loop. Join the Project Unity listserv where you will be able to find everything that we're doing in addition to Catalyst Academy. Follow our LinkedIn, our YouTube, and reach out via email to collaborate. We've had several people during this conference already reach out to us and are interested in collaborating. We welcome that, and we were happy to create like a powerful next year together.
From the Unity Board of Advisors and Directors, we thank each and every one of our students for your hard work, dedication, and unyielding commitment to creating something great. We are very proud and honored to have shared this journey with each of you and for you to allow us to be part of your journey in your life. As we draw the curtains on the extraordinary Project Unity Summer Conference, we have witnessed the incredible power of dedication, innovation, and collaboration in the pursuit of public health and social justice. Our summer interns have shown us with compassion and determination, we can create a better and healthier world for everyone.
In these trying times, as we face complex societal issues, it's easy to feel overwhelmed and powerless. And at Project Unity, it's been our mission and our vision to build a community of change makers united by a common purpose of creating a healthier and more equitable society. Today, that vision has come to life, not only through our interns, but also through all of you who have supported, mentored, and cheered them on. Public health is not just a profession, it's a calling. It's a call for all of us to stand up for those who have been marginalized and silenced. It's a call to address the root causes of disparities and a call to foster a culture of compassion and understanding.
And finally, our plea to each one of you is to stay engaged, stay committed, and stay united. The work of Project Unity does not end here. It is only the beginning. We need all of you, the researchers, the mentors, the supporters, and the advocates, to continue this journey with us. Join our mission and follow us on social media so you can view our successes. And thank you all for being part of this incredible experience and for your time to support our students. With that being said, the 2025 Unity in Public Health Research Conference, Innovation in the Age of Misinformation, is adjourned. Thank you, everyone. If students and mentors can stay back for 5 minutes, that would be great as well.
Thank you, everyone.